charge for something
For
like
individuals that call in, certainly it's free. If somebody wanted 10,000 of these, there would be a fee for those.
Okay. And then teens. I mean, prevention. Prevention is, I mean, the Lung Association said it's about prevention and it's about cessation when it comes to the smoking.
We have two programs. One is called NOT, which stands for Not on Tobacco, and that is a program where we assist teens in quitting smoking. There is a program called Tattoo, and it's not the tattoo you think of. It stands for Teens Against Tobacco Use. And that is a mentoring program. That's where teens in high school mentor young people in middle school so they don't start smoking.
And there are many times that parents catch their kids with cigarettes.
Sure, we get those calls all the time. What do I do?
Tell me what you do.
It is one of the most difficult situations. Teens are so impressionable. Peer pressure. They think they're immortal. They, you know, nothing's going to hurt them. Nothing's going to ever cause them to be sick. And we work with teens a great deal on trying to make them understand that smoking is not the appropriate thing for them to do. There are other things they could be doing. I had two teenage daughters, and you know, it's very difficult to communicate with them. That's why I think too there are teens. You know, when you have teens working with teens or other people, when they're in their peer group, when they're working with their equals, it's different than having an adult sit there and say, you know, you shouldn't do this kind
So
of
tattoo is very effective.
It is. It can
because
be.
it's peer to peer. But a lot of parents, I think that what I say doesn't make any difference. But in fact, all the research has shown us that telling your child that you don't want them to smoke and explaining the health facts about this is very important. And most of us don't know the health facts. So you can help us, you can educate us.
And with a cigarette today, you can become quickly addicted much faster than you did in the past.
And that's because they've added something to the
They've
cigarettes?
added ammonia to the cigarettes, and ammonia does make the cigarette more addictive.
So if that happened in the last 8 years and we have an 18-year-old, we might not be so concerned about because maybe we smoked a little bit when we were in high school or college and we stopped, but it's not so easy.
It was a different story back then. And you know, the average age, Pat, where people start smoking is 11 and a half years old. Some parents may not be aware of that. So, you know, and if you start smoking at 11 and a half, I get calls every day in the call center in relation to that. So I started smoking when I was 9, you know, and I'm sitting there going, ooh.
And that's, I think, one of the reasons why the prevention is so important in the junior high.
It is. And even if you're, you know, teenagers will experiment. But you know, if you sit down and you talk with them intelligently and give them the rationales for not doing this, hopefully they won't pick up the habit.
And this is another reason also why you try to work with the physicians, because we also know that although I'm sure they feel like when they, you know, sometimes they think they're talking to a brick wall. Physicians really have a great impact on children and adults.
They do.
And so these resources can be very good for them to be able to hand to their patients and say, you know, read this.
Pediatricians, you know, general physicians. It's so important to intervene.
And that we need to ask that question.
Well, you do.
And I think that's the most important thing, that, you know, again, a physical exam is more than just, you know, what the body's telling us, that our social habits and what we do can hurt our health in the future, and the prevention is very important.
Teens know. They know whether it's good for you or bad for you. I mean, it's no secret. They are in an age where, like I said, there can be pressures and they're impressionable, and if we can just sit down and educate them, you know, ultimately these teens turn into very wonderful people, and they hopefully just don't pick up those types of habits. And
One of the things that Parent Helpline works so hard on is to have parents be positive in their approach with their children. To not say don't smoke, but to encourage other things instead, and to give positive messages. And I think that especially with families that are dealing with lung diseases, you know, whether it's asthma, a lot of a child with asthma, it's really hard. I mean, I had a son who had to do breathing treatments, you know, before he went to school, at lunchtime, after school, before he went to bed. And this can be a tough thing. So your call line, you know, you can actually help parents use that. I mean, the neat thing is that while doing a treatment, it's a great time to read a book. It's a great time to do bonding. You know, how you can help us think through situations and to put a positive twist on.
Well, here's another point that you have to remember about teens or adults. Coercion, harassment, whatever
Yelling,
term,
screaming.
yelling, screaming. If any of those worked, nobody would smoke. So obviously that type of intervention doesn't do any good. It just doesn't work. So calmly, intelligently sitting down with an individual in a pleasant situation and say, you know, look, you're very important to me. I want you around for as long as you can possibly be around, and I can possibly be around. Here's my feelings on this, and I really wish you wouldn't do this. If there's anything I can do to help, please let me help.
Can a teen as well as a parent call the call center?
Absolutely.
So that anybody that wants information, and sometimes I think what parents tell kids don't stick as much as say, you know, I'm worried about this, I've called, but you call too, and you
Well,
know,
one of the
find
things
out about
we
this.
won't do is we won't tell, when anybody calls us, the conversation is confidential. If they don't want the parent to know, we can't tell the parent in that situation that, you know, what's going on. But it's also nice to know that if the teen and the parent came to this conclusion together and worked together as a nurse or a therapist and a family unit, that's a very effective way to go about handling this.
Let's talk a little bit about some of the reasons why people would call. I mean, what are some of the typical calls you would get from the call center that might spur people to say, oh, I could call about that?
We frequently get calls from people who have recently been diagnosed with a particular lung disease and provide information, or a family member, loved one. My dad has just been diagnosed with COPD or emphysema, and we get questions like that. We get questions about all types of environmental issues, indoor air quality in the home, any type of situation that could impact the respiratory system. We get questions on asbestos. We get questions on black lung. There are so many situations out there that can impact the respiratory system that it's virtually limitless, including some of the very, very rare diseases that you know, may crop up. Our resources are extensive. We have